Welcome back to another deep dive. This is where we sift through a whole lot of information. It could be articles, clinical notes, research, and really pull out the core stuff, the things you need to know, and hopefully make it, genuinely
And
interesting.
accessible is the goal.
Exactly. So this week, we're tackling a really powerful medication. It's often linked with like amazing results for severe acne, but it also comes with some, well, very serious safety considerations.
Oh, absolutely. This is a drug that demands a, let's say, meticulous approach from everyone involved, really the patient, the person prescribing it, the nurses, the pharmacists. The stakes are quite high.
Right. But the potential upside for the right patients can be huge too.
Definitely.
We're diving into isotretinoin today. You might know it by brand names like Accutane, maybe Absorica, Claravis. There are others too.
Mm-hmm.
So think of this deep dive we're pulling from detailed clinical sources here as getting those crucial insights, especially, the stuff that really matters if you're maybe studying for nursing boards or just want to be properly informed about such a potent drug.
Our sources really focus on how it works, who it's actually for, and critically, those absolutely essential safety rules and monitoring. That's key.
Okay, so our mission today is pretty clear. Unpack the essentials of isotretinoin, what it does, why it's used only in certain cases, and the non-negotiable safety stuff like the IPL-AGs program, which we'll definitely get into.
Exactly. Highlighting the must-know points, particularly from that healthcare perspective.
All right, let's jump right in. First things first. What is isotretinoin fundamentally? How does it actually work against acne?
Okay, so pharmacologically, its classification is a retinoid.
Like retin A, that kind of thing.
Sort of related, yeah. Retinoids are vitamin A derivatives. Therapeutically, it's an anti-acne agent. But what's really interesting is how it works. It's actually a metabolite of vitamin A itself, retinol.
So like related to the vitamin A we get from food, carrots and stuff.
Pretty much, yeah. But in this specific medicinal form, it has a very potent, very targeted effect.
Hmm.
Its main job, its primary action, is to significantly shrink the sebaceous glands.
The oil glands in the skin.
Exactly. It makes them smaller, and it also changes how they differentiate, how they mature and function. Basically, it dials way down their oil production.
Wow. Yeah.
And the sources also mention it might help prevent abnormal keratization that's part of the process where pores get blocked.
So it's not just like drying out the surface. It's hitting the root cause of the oiliness.
That's the idea. By shrinking those glands, cutting down the sebum, the therapeutic effect you see is this powerful reduction and hopefully resolution of really severe acne. For patients who've tried everything else for their nodular acne, well, this can be genuinely life-changing.
That is fascinating. Can we do a quick look at how the body handles it, the pharmacokinetics?
Sure. So it's taken orally, absorbed that way. And interestingly, taking it with a high-fat meal can increase absorption for some formulations. Though some sources note specific products like Absorica can be taken without regard to meals. So check the specific product info. Once it's absorbed, it gets distributed pretty widely in the body, and it binds strongly to proteins in the blood. Metabolism happens mainly in the liver,
Okay.
and then it's excreted through both urine and feces. Its half-life, how long it takes for half the drug to leave the body, is roughly 10 to 20 hours. Knowing this helps understand its presence in the system, but day-to-day dosing is mostly guided by the specific instructions.
Right. And how long does it actually take for someone to see results, like see their acne improving?
Well, the exact onset isn't perfectly defined, but reaching that peak effect, that really noticeable reduction in acne, can take up to 8 weeks.
8 weeks. Wow.
Yeah, so patients absolutely need to understand it's a process. It requires commitment. Results aren't going to happen overnight.
Okay, so potent vitamin A derivative targets oil glands, takes time to work. Who is this actually for? Who's the intended patient?
This is really specific. The indication is for severe recalcitrant nodular acne.
Can you break that down a bit?
Sure, severe nodular acne means someone has multiple inflammatory nodules. Those are like deep, painful bumps, usually 5 millimeters or larger. And recalcitrant means their acne hasn't responded adequately to other treatments they've tried.
Including antibiotics.
Yes, crucially, including systemic antibiotics. So this isn't for your typical teenage breakout or mild adult acne. It's reserved for those really tough, persistent, often scarring cases.
A last resort, essentially.
Pretty much, yeah. For those really debilitating forms, the approved population is adults and kids 12 years and older. Safety in children younger than 12 hasn't been established.
Got it. And how's it usually dosed and given?
The typical oral dose for adults and kids 12 plus is usually somewhere between zero point 0.5 and 1 milligram per kilogram of body weight per day. That total daily dose is given in 2 divided doses.
Okay.
For very severe cases, the dose might go up, even as high as 2 milligrams per kilogram per day. And a standard course of treatment lasts about 15 to 20 minutes.
What if the acne comes back after they stop?
That can happen sometimes. If there's a significant relapse after finishing a course, the sources say therapy can be started again, but only after at least an 8-week break from the medication.
An 8-week rest period. Okay.
And it's also worth noting, like we touched on briefly, there are different formulations. Absorica, Absorica LD, they aren't interchangeable. They have slightly different dosing recommendations specified in the source material. Always check the specific product info.
How should people take the capsules? Any special instructions?
Yes, definitely. Take them with a full glass of liquid. That helps reduce the risk of irritating the esophagus.
Makes sense.
And this is critical, the sources emphasize. The capsules must not be crushed, chewed, or opened. Swallow them whole.
Okay, don't open the capsules. Got it. Anything else?
Just to manage expectations sometimes, right at the beginning of therapy, acne can actually seem to get a bit worse before it starts getting better. Patients should be prepared for that possibility.
Good to know. Okay, we've covered the basics,
Yeah.
what it is, how it works, who takes it. Now, the really crucial part, the safety stuff. This is where isotretinoin gets, well, complex and requires extreme care.
This is absolutely the heart of managing this medication safely. The safety considerations and the monitoring are paramount.
And number one on that list, the absolute top priority, has to be the pregnancy risk.
Without a shadow of a doubt, isotretinoin is a known potent teratogen. That means it carries a very high risk of causing severe, life-altering birth defects if taken during pregnancy. This risk is the entire reason for the incredibly strict program surrounding it.
Which is called IPL.
Exactly. The IPLEDGE REMS program, REMS, stands for Risk Evaluation and Mitigation Strategy. It's a mandatory program approved by the FDA, specifically designed as a restricted distribution system to minimize the risk of fetal exposure.
So this isn't like getting a prescription for, say, an antibiotic. It's much more controlled.
Way more controlled. Only healthcare providers who have registered with the IPLEDGE program and completed the necessary steps can prescribe it. And only pharmacies that are registered and activated in IPLEDGE can dispense it. And of course, only patients who are registered and meet all the program's requirements can actually receive the medication.
And for patients who can become pregnant,
Yeah.
those requirements are incredibly strict, right,
Yeah.
to deal.
They are absolutely vital and non-negotiable. These patients must understand and agree to use 2 effective forms of contraception simultaneously.
2 forms.
2 distinct, reliable methods. And this isn't just during treatment. It has to start 1 month before they even take the first pill. It must continue throughout the entire course of therapy every single month. And then it must continue for at least 1 full month after they take their last dose.
Wow. So months before, all the way through and a month after.
Yeah.
That is a significant commitment.
It truly is, and it has to be, given the potential consequences. On top of the contraception, they need 2 negative pregnancy tests before they can even get the first prescription filled.
2 initial tests. What kind?
They need to be sensitive tests. The source specifies serum or urine tests with a sensitivity of at least 25 milli-international units per milliliter, which is a standard measure. Basically, capable of detecting pregnancy early.
And is there specific timing for those first 2 tests?
Yes. The first test is done by the prescriber, usually around the time they decide isotretinoin is the right option. The second required negative test happens after the patient has been consistently using their 2 chosen forms of contraception for 1 full month.
Okay, after a month of contraception.
Right. And the timing of that second test is also specified. It should ideally be done during the first 5 days of their normal menstrual period. If they don't have regular periods, say they have amenorrhea, then the test needs to be done at least 11 days after the last time they had unprotected sex.
That's very specific. And the testing continues after they start the drug.
Absolutely. A negative pregnancy test meeting those same sensitivity requirements is mandatory every single month before each new prescription can be authorized and dispensed. Every month for the entire duration of therapy.
Okay. What happens if, despite all these precautions, pregnancy is suspected, or actually occurs during treatment, or in that critical month after stopping?
The medication must be stopped immediately, no question. The healthcare provider needs to be notified right away. And critically, any suspected or confirmed pregnancy during treatment or within 1 month after stopping must be reported.
Reported where?
It must be reported immediately to the FDA via their MedWatch program and also directly to the IPLEG pregnancy registry. This reporting is crucial for tracking outcomes and understanding the real-world effectiveness of the REMS program.
The source also mentioned something about a consent form.
Yes, there's a specific required patient consent form provided by the drug manufacturer. It explicitly details the severe risks to a fetus. Patients have to read this, understand it, and sign it, confirming they grasp the risks before they can start.
And for minors.
For patients under 18, a parent or guardian must also read, understand, and sign the consent form alongside the patient. The source even mentions a detail about yellow self-adhesive stickers that prescribers put on the prescription to show the pharmacy that the patient has met the monthly IPLG requirements.
Wow, the layers of verification are intense. What about other related issues, like breastfeeding or donating blood?
Good questions. Patients should be strongly advised not to breastfeed while taking isotretinoin and for at least 8 days after their last dose because the drug can pass into breast milk,
Okay.
and blood donation is also a no-go. Patients must not donate blood during therapy and for at least 1 month after their last dose.
Why is that?
It's to prevent the possibility that their donated blood containing the drug could accidentally be transfused into someone who is pregnant, potentially exposing the fetus.
That makes sense. The level of detail around reproductive safety is just striking. It really underlines how serious that teratogenic risk is.
Okay.
Let's broaden out a bit. Beyond pregnancy, the sources list other potentially serious adverse effects. What are the next big things to watch for?
Right, because the vigilance doesn't stop with pregnancy prevention. A major area of concern highlighted in the sources is the potential for psychiatric or behavioral changes.
Like what?
Things like new or worsening depression, anxiety, mood changes, even psychosis in rare cases, and tragically, suicidal thoughts or behaviors. This is extremely serious.
Absolutely.
So, close monitoring for any changes in mood, behavior, or thinking is essential. Patients and families need to know to report any concerns to their doctor immediately. The positive side is that these issues usually resolve after the medication is stopped.
That's incredibly important to monitor. What about skin reactions? I mean, it's for acne, but can it cause other skin problems?
Well, yes. While very dry skin is almost universal and expected, there's a rare but real risk of severe, life-threatening skin reactions, specifically Stevens-Johnson syndrome, or SJS, and toxic epidermal necrolysis, TOM.
Those sound serious.
They are medical emergencies. People need to watch for signs that might start subtly, maybe fever, feeling unwell, muscle aches, but then progress to blistering, skin peeling, painful sores, especially in the mouth, eyes, or genital area. If anything like that starts, the drug must be stopped immediately and medical help sought urgently.
Okay, SJS and TON. Got it.
Yeah.
I've also heard about eye problems with isotretinoin. What do the sources say?
Yes, eye issues are fairly common. Things like conjunctivitis, that's like pink eye, inflammation. Very dry eyes are frequent. Some people experience blurred vision. A specific issue is decreased night vision.
Decreased night vision.
Yeah, so patients should be cautioned about driving at night, especially early in treatment or if they notice changes. Also, people who wear contact lenses might find them really uncomfortable or intolerable during treatment and may need to switch to wearing glasses instead.
And you mentioned dryness is common. Is that just eyes and skin?
No, it's pretty widespread. Very dry skin is a given. And chapped lips, the medical term is cheilitis, are extremely common.
Yeah.
Lip balm becomes essential. Dry mouth is also frequent, so maintaining good oral hygiene, maybe using sugarless gum or candies, can help manage that.
Okay. What about effects on, like, internal organs or metabolism?
There are potential impacts there, too. The sources mention potential liver effects, including hepatitis, though that's less common. Pancreatitis, inflammation of the pancreas, is another risk, sometimes linked to high triglyceride levels.
Triglycerides, like blood fats.
Exactly. Hypertriglyceridemia, meaning high levels of triglycerides in the blood, is a significant concern and can sometimes be severe. This needs monitoring. You can also see increases in total cholesterol, decreases in HDL, the good cholesterol, and potentially hyperglycemia or high blood sugar. This can make blood sugar control harder for patients with diabetes. Also, increased uric acid levels are possible.
What about effects on muscles or bones?
Yes, the sources list potential musculoskeletal effects. Things like joint pain, which is called arthralgia, back pain, and sometimes increased muscle or bone pain. This seems to be noted particularly in adolescents during growth spurts. Less commonly, something called hyperostosis, which is like excessive bone growth, can occur usually with long-term or high-dose therapy.
That's quite a list of potential issues.
Mm.
Given all this, what are the key lab tests people need while taking isotretinoin?
Okay, so beyond those crucial monthly pregnancy tests for females who can become pregnant, other lab monitoring is essential for everyone. Liver function tests are key enzymes like AST, ALT, LDH. These should be checked before starting, usually again after about 1 month of treatment and then periodically after that.
And what about those lipids, the triglycerides and cholesterol you mentioned?
Definitely need to monitor blood lipids. That includes total cholesterol, HDL cholesterol, and especially triglycerides. These should be checked from a fasting blood sample.
Fasting, okay. How often?
Initially, monitoring might be more frequent, maybe every 1 to 2 weeks, especially for triglycerides, until the levels stabilize, which often happens within the first month or so. After that, periodic monitoring continues throughout the treatment course. Significant elevations need to be addressed.
Anything else on the lab checklist?
Yeah, the sources also recommend getting a baseline complete blood count, a CBC plus urinalysis, and a basic metabolic panel before starting, and then monitoring these periodically during treatment too.
Why those?
Well, the CBC can sometimes show decreases in red or white blood cells. The metabolic panel monitors electrolytes, kidney function, glucose, and uric acid. Urinalysis might pick up things like protein or blood cells in the urine. You might also see changes like increased platelet counts or increased levels of creatine kinase, CK, which relates to muscle, or sedimentation rate, which indicates inflammation. It's about keeping a comprehensive watch.
Okay, so meticulous lab monitoring is clearly part of the package. What about interactions? Does isotretinoin clash with other medications, supplements, or even food?
Yes, several important interactions to be aware of. A significant one is the increased risk of something called pseudotumor cerebri, which is basically increased pressure inside the skull if isotretinoin is taken at the same time as tetracycline antibiotics, like tetracycline itself or minocycline. Those are sometimes used for acne too, so they should not be used together.
Good to know. Avoid tetracyclines. What else?
Taking extra vitamin A supplements is a definite no-no. Since isotretinoin is a form of vitamin A, adding more can lead to vitamin A toxicity hypervitaminosis A. Also, drugs with anticholinergic effects might worsen the drying side effects, like dry mouth or eyes.
And using other acne treatments at the same time.
Yeah, using other topical acne products, things like benzoyl peroxide, sulfur, even topical tretinoin, another retinoid, concurrently can really increase skin dryness and irritation. Patients should definitely talk to their doctor before combining treatments.
What about alcohol?
Alcohol should really be avoided. The sources strongly advise against it because it can significantly increase the risk of developing those high triglyceride levels we talked about, which in turn increases the risk of pancreatitis.
Okay, avoid alcohol. Food interactions. You mentioned vitamin A supplements.
Right. Along similar lines, patients should avoid excessive intake of foods that are super high in vitamin A. The sources mention things like liver, certain fish liver oils, maybe large amounts of fortified milk or margarine, and some specific fruits and vegetables known for high vitamin A content. It's about avoiding overload.
Got it. Any other products people should be cautious about?
Generally, patients should always tell their healthcare provider about everything they're taking prescriptions, over-the-counter meds, herbal products, supplements. The source specifically mentions St. John's wort as something to discuss with the provider, as it can interact with various medications. Also, using harsh soaps, certain cosmetics, or maybe drying shaving lotions might just make the expected skin dryness worse.
Okay, so bringing this all together, if you're a patient starting this, or maybe a nurse educating a patient, what are the absolute essential take-home messages for using isotretinoin safely?
Well, the patient teaching summary really has the key points. First, take the medication exactly as prescribed, usually twice a day with that full glass of liquid, and crucially, never crush, chew, or open the capsules.
Right.
Second, be prepared for that possibility that acne might flare up a bit initially before it improves. Third, report any side effects promptly, especially any changes in mood, thoughts, or behavior. Also report any vision changes, severe abdominal pain, rectal bleeding, or signs of those severe skin reactions.
What about managing the common stuff?
Manage the expected dryness, use lip balm constantly, moisturize skin frequently, be extra careful about sun exposure, use sunscreen, wear protective clothing, because the skin will be much more sensitive to sun.
And the big dumps.
Definitely avoid vitamin A supplements and excessive high vitamin A foods. Avoid alcohol completely, and absolutely do not donate blood while taking it or for 1 month after stopping.
And for patients who can become pregnant.
This is the absolute cornerstone. You must understand and strictly follow all the IP-led requirements. That means using 2 effective forms of birth control consistently starting before, continuing during, and for a month after treatment. And getting those mandatory monthly pregnancy tests without fail. No shortcuts.
And follow-up.
Yes, regular medical follow-up appointments are essential, and completing all the required lab tests is non-negotiable for monitoring safety.
So after going through all this rigorous process,
Yeah.
what's the actual goal? What outcome are we looking for, and how long does it usually take?
The main desired outcome is a really significant decrease. The target is often around a 70% reduction or more in the number and severity of the acne cysts. As we said, seeing the full effects might take a good 4 to 5 months.
And when is the treatment usually stopped?
Therapy is typically continued until that 70% reduction is achieved, or sometimes up to a maximum duration, often around 5 months, depending on the dose and response.
Does the skin keep getting better after stopping the pills?
Interestingly, yes. The sources note that improvement can often continue for some time, even after the medication course is finished.
Oh, that's good to know.
Which is why, if a relapse occurs and a second course is considered, they recommend that minimum 8-week rest period we mentioned earlier to see the full effect of the first course and let the body clear the drug before potentially starting again.
Okay, so we've really unpacked isotretinoin today. It's clearly a remarkably effective medication for those severe, tough-to-treat acne cases. It can offer truly transformative results.
Absolutely transformative for the right patient.
But as we've spent a lot of time discussing, it absolutely demands this incredibly rigorous, multi-layered approach to safety and monitoring. It's not a drug to be taken lightly.
Not at all. We've talked about its powerful action on the oil glands, but just as importantly, the absolute undeniable necessity of strict adherence to the IPL-DEG program to prevent those devastating birth defects. Plus, the need for ongoing vigilance for other serious potential issues, those behavioral changes, the rare but severe skin reactions like SJS10, and the critical role of consistent lab monitoring for liver, lipids, blood counts, and more.
And drawing from these detailed clinical sources, the kind used in healthcare training, hopefully this deep dive gives you, our listeners, the critical details needed to really understand this medication thoroughly. Whether you're maybe studying for an exam where isotretinoin is almost certainly high yield,
Definitely high yield.
or you're caring for patients, or even just building your own knowledge base about potent medications, understanding this level of detail is what makes managing a drug like isotretinoin possible and ultimately safer.
Which leads us to maybe a final thought to consider. When you have a medication like this one that offers potentially life-changing positive outcomes, but simultaneously comes with such significant, potentially dangerous side effects and these incredibly complex safety requirements, what does that really tell us? What does it emphasize about the kind of partnership, the shared responsibility that's absolutely required between the patient, the prescriber, the pharmacist, the nurse, everyone involved in that healthcare journey?
That's a really powerful point to end on. That partnership is key.
Mm.
Okay, that wraps up our deep dive into isotretinoin for today. We really hope these insights have been valuable for you. Keep exploring, keep learning.